Are you just getting out of total knee replacement surgery? So here's one of the most important tools you should have, and 3 things that you're going to be able to do with this tool that will help you tremendously after a total knee replacement. I'm Dr. Patrick Figueiredo here at Physical Therapy Balance Centers in Harker Heights. And today we're going to be showing you some activities that you should be able to do when you have this PurePT Stretch Strap, right? So I like this strap because it is a lot longer. It is a nylon type of material that will be comfortable and not rubbing and roughing the skin, especially after surgery. Things can get very sensitive in there. So you want to make sure that you are comfortable as well. Okay, so getting out after a total knee replacement, right? Doctors want you to start walking right away, putting weight on it. So it will be challenging to straighten the leg, and it will be challenging to bend it as well. So this tool will be very helpful in the beginning of these stages for you to make your life a lot easier, right? So first important thing, I will take it everywhere with you, take it to the surgery, so that way you can have the transportation easy for you to get in and out of the car, in and out of bed. And let's see what I mean by that. So if you are having a surgery on that left knee, so it will be stuff, will be a lot of things in there, some wraps, and it will be very hard for you to just be able to lift that leg because of the weakness, because of pain or lack of feeling in the beginning of stages. So what I would recommend, you can loop your foot into the strap, and then from here you can use the strap to be able to get your leg up into the bed, right? And then all the way back in. Similarly, we'll go to the car, you'll be sitting on that car and then placing and kind of helping it to go on that front seat to be able to get yourself in, and then you can use the strap to help you get yourself out from it as well. Okay, so now exercises and activities. One of the most important things is to be able to keep that leg straight. So first thing to avoid is having cushions underneath in here. I know it's going to be comfortable and you would like to be pain-free, but it is important for us to maintain that full knee extension, right? So full knee stretch. So an easy way to do it, as you maintain that in here, you can do 2 variations. You can just lay like this, push a little bit, and then you can stretch that leg back and kind of lifting slightly, increasing some of that tension. I can feel the stretch here on my hamstrings all the way to the calf. So that will be one thing that you'll be able to do with it, right? So once you are in bed and relaxed and you're able to do a little bit more, we can use that same stretch while elevating to help with some of that swelling to go away as well, right? So you can lift that leg, trying to keep it straight, use it in here. If you feel your hands are a little bit too weak, you're not able to hold, those straps here are long enough that you can mainly use your forearm for that support. So that way you have your hands free to, avoid any pain or any discomfort. So you can use your forearm for that support in there. Okay, so those are the maintaining knee straight type of activities and helping you get in and out of bed, out of the car using this strap. So a lot of things that you're going to be doing, right? If you're starting home physical therapy, or if you're going to a facility, or if you come to an outpatient setting like we are in here, we're going to be also helping you to bend the knee, right? We have a goal to increase that knee mobility for you to be able to walk and negotiate curbs and get your life back again. That's the main reason why you did the surgery. So I would recommend doing on a surface that is slickery. We use a like a transfer wood board that you can have, some socks. If patients have their sneakers on, you can use a pillowcase, something that will allow that motion to happen a little bit more freely without a lot of resistance. And then similarly, you're gonna be able to wrap it around. You can start with that stretch and then you can lay down and use your hands to give that oscillation back and forth, helping you to bend that knee, right, to be able to get in this. And this is a cycle. I usually like to stay here for a while. So without much of the tug, we're not working on being uncomfortable, but we're gonna try to gain motion through all the repetitions that you go. So you can do 10 repetitions at a time and take a break. The more you do, we usually do for about 4 or 5 minutes repetition, making sure you're getting the full range, both straight and bend, and do that a few times a day. So that will help you a lot when you are getting out of the surgery and the first few steps getting into the rehab program going up. So a strap stretch is going to be very important, so you can help with transfers from standing to get to your bed, to get to your car. You can use the assistance in order to keep your legs straight in the bed, and fully straight up as well, to help a little bit of that stretch. And we are also able to do some lubrication of the joints by getting a little bit of that cycle, straight and bend, straight and bend, utilizing your hands and your ability to do so. So this is a very important tool. I highly recommend to get you started right out of the gate. There are a lot of things that you can do with it and to make you feel better sooner. Okay, I hope this helps. Let me know in the comments if you've been getting some success with the tool and with these exercises. Hope you have a great day.